Assalamu alaikum everyone. Welcome to my YouTube channel Medical Pro. I hope you guys will be fine and doing great and enjoying your good lives. Okay, so today we are going to start our new series. So this series is basically going to be very beneficial for the AR kind of a persons. Like if you are going to follow up on different kind of insurance companies for the outstanding and unpaid claims, then this series is going to be quite helpful for all the RCM kind of a guys, because we are going to discuss the denials management, like what are the denials and how you guys can fix the denials. So this is quite important for you guys, that what kind of a denials you will have in medical billing and how you guys can just go through all that kind of a stuff and resolve all those kind of errors. So we will be discussing all those kind of a stuff. Okay, so this is quite a good series. Okay, so you guys can just go through all those kind of a lectures which will be coming in our series. Okay, so if you guys feel any kind of a difficulty while any kind of a lecture, then you guys can let me know. Okay, so this series is going to be especially for denials management in medical billing and coding section. So अगर आप medical billing companies में काम करते हैं और वहाँ पर आपको काफ़ी difficulties आती हैं कि हमें किस तरीके से जो denials होते हैं उनको fix किया जा सकता है, किस तरीके के denials होते हैं जो हमें पेश आते हैं, so all that kind of stuff we are going to discuss in this series. Okay, इसके अंदर कुछ means ये कि near about we will be having 20 lectures. Okay, so without wasting time, I guess we should start our lecture and see what is basically the denial management in medical billing. So first of all, introduction to denials management in medical billing. Okay, so denials management in medical billing refers to the process of identifying, analyzing, and addressing denied claims to ensure that healthcare providers receive proper reimbursement for the services rendered. Yes, you guys know that. What is the basic purpose of medical billing? That medical billing companies are going to get the reimbursement for the providers for those kind of services which were done by that kind of a provider. It is an essential aspect of revenue cycle as it directly affects cash flow and the overall financial health to healthcare organizations. Denials management aims to reduce the number of denials, streamline the process of resolving them, and ensure that claims are paid promptly and accurately. By effectively managing denials, healthcare organizations can improve their revenue cycle efficiency and minimize financial losses. Yes, you guys know that. देखिए जब भी कोई क्लेम हमारा इंश्योरेंस की तरफ जाता है, so if there is any kind of a denial, then there is a AR team, then they are going to resolve that all that kind of a stuff, all those kind of a denials. उसके ऊपर कोई रिजेक्शन है, कोई डिनाइल है, सो उसको हमने फिक्स करना होता है. ये डिनाइल्स बेसिकली ये है कि मीन्स इसकी डिफरेंट टाइप्स हो सकती हैं. इसके अंदर मीन्स ये है कि कोई पेशेंट की इन्फॉर्मेशन के अंदर एरर हो सकता है, पेशेंट की डेट ऑफ बर्थ, पेशेंट की रजिस्ट्रेशन, पेशेंट की इंश्योरेंस आईडी गलत हो सकती है, ये पेशेंट इनएक्टिव हो सकता है डेट ऑफ सर्विस के ऊपर. ठीक है, सो ऑल दोज काइंड ऑफ थिंग्स कैन हैपन. सो बेसिकली वी विल बी जस्ट हैविंग ऑल दोज काइंड ऑफ डिनाइल्स कि हाँ भी इस किस तरह के डिनाइल्स हमें पेश आ सकते हैं इन मेडिकल बिलिंग. ओके, सो यू गाइज कैन जस्ट फिक्स ऑल दोज डिनाइल्स. Okay, so this is our introductory lecture today, and we will be discussing that what are the basically denials and how you guys can just fix them. But with the passage of time, we will be just having different kind of denials examples and the real scenarios as well, that how you guys can just fix all those kind of denials. So denials, you guys can say that whenever you have a denial, you guys need to fix that one with different strategies, different kind of information. Okay, so what are the basic ways and means through which you guys can just fix all those denials? And if your denial rate is low, then your cash flow will be high. So what is the basic purpose of medical billing? Yes, the basic purpose of medical billing is going to get the reimbursements for the provider for the different kind of services which that provider has done. Okay, so if you guys have any kind of a questions regarding medical billing or medical coding, denials management, jobs related questions, you guys can WhatsApp me. My WhatsApp number is already revealing on the screens. Okay, so you guys can just go through my YouTube channel and as well. Okay, you guys can watch different kind of lectures on medical billing too. I have already uploaded a medical billing basic course over there, so you guys can just watch all those kind of lectures in a serious way. Okay, so what are the key concepts of denial management? Means बेसिक जो डिनाइल मैनेजमेंट की जाती है उसके अंदर मीन्स हमारे की कंसेप्ट्स जो हैं वो क्या चीज़ें होती हैं. सो पहले डेफिनेशन देख लेते हैं. सो बेसिकली व्हाट इज अ डिनाइल? A denial occurs when an insurance company refuses to pay for a claim or part of the claim. This could be due to the various reasons, including errors in the submission process, incorrect coding, eligibility issues, or lack of pre-authorization. Yes, whenever medical billing companies are going to submit the claim to an insurance company and insurance company deny that claim due to certain reason, that could be the eligibility issue, that could be the information issue, that could be the coding issue. There are a lot of denials reasons, okay, so which can arise due to different kind of a lack of administration or management or the human error. Okay, so basically insurance company is going to process that claim, and after processing, insurance company is going to deny that claim, and they are also going to send us the EOB for the denial reason as well, explanation of benefits, like this was the denial basically. So in this way you guys can just they will be just having different kind of a codes over there revealing that these kind of denials can happen. Okay, so next we see that what is rejection versus denial. So this question can arise in your interview as well. Means rejection और denial में क्या difference होता है? Let's see. A rejection happens when a claim is not processed by the payer because of incorrect or incomplete information. Example given, wrong patient details, missing data. Yes, the billing companies who are going to submit their claims through clearing houses. Okay, so they are the clearing house basically is going to interpret and address all those kind of things in that claim. So if there is an issue regarding like patient information, patient's name, date of birth, or any kind of that kind of a thing, then the clearinghouse is not going to submit that claim to an insurance company. So before, basically clearinghouse is kind of a bridge between the medical billing company and the insurance company. Okay, so the claim will be revert back, or you guys can send back to the provider that you guys need to fix that kind of a thing. Okay, so fix that kind of error. So insurance did not get that claim, did not receive that claim, did not process that claim. So on the first hand, the claim is rejected. So that is not submitted to an insurance company. After fixation, like you guys can fix that kind of error, then you guys can submit the claim. Okay, so this is basically the rejection. Next is a denial, occurs when the claim is processed but is subsequently denied for reasons like medical necessity, eligibility, or coverage issues. So whenever an insurance company gets a claim, they are going to adjudicate that claim, and after adjudication, they are going to process the claim, and they are going to also send the EUB as well. Then that kind of a denial means if they are not going to pay for that claim, then that's basically count as denial. Okay, so rejections means insurance did not get that claim, the claim is denied, or you guys can say rejected initially at the end of clearinghouse, and once the insurance gets the claim, then and they are also going to process the claim and providing us the EOB, then that means that that is a denial. Okay, so this is basic difference between the rejection and the denial. Okay, so let's see what kind of a next we have. So what are the basically types of denials in medical billing? Okay, so in medical billing, there are different kind of denials. Here are common categories of denials in medical billing, like eligibility related denials. So let's see what are the eligibility related. Eligibility means if a patient is active with that kind of insurance on the date of service or not. So patient not eligible on the date of service. So this could be a denial. Yes, if the patient is not eligible on the date of service, then why the insurance is going to process that claim? Next one is incorrect insurance plan details. Yes, the plan details which insurance company has received, they are going to be the incorrect one. So insurance company is not going to pay for the services. Coverage not available for the specific services. Yes, the services which were rendered by a healthcare provider, so these services are not covered under the patient's benefit plan. ठीक है, मीन्स कोई भी जो सर्विसेज प्रोवाइडर ने दी हैं, जो मेडिकल डॉक्टर ने उसको पेशेंट को प्रोवाइड की हैं, सो जब उसका क्लेम भेजा जाता है और इंश्योरेंस कंपनी इस वजह से डिनाई कर देती है कि हाँ भी ये जो सर्विसेज थी ये पेशेंट के प्लान में आती हैं, जो पेशेंट ने हमसे प्लान परचेज किया है, सो दीज काइंड ऑफ डिटेल्स आर यू गाइस कैन से सर्विसेज are not considered under the member's benefit plan. So insurance company is not going to process that claim and pay that claim. So ये eligibility related denials हो सकते हैं. Next is authorization denials, lack of prior authorization. So there are certain services which require prior authorization. Okay, so medical billing companies require authorization number before processing that claim. Or you guys can say that whenever the medical provider is going to provide different kind of services to a patient, so for certain services they require prior authorization. Okay, so इस वजह से भी अगर उसके ऊपर वो authorization number नहीं है on that claim, then insurance company is not going to pay that claim at all. Invalid authorization, yes, the authorization number could be invalid or expired. ठीक है, invalid भी हो सकता है और expired भी हो सकता है, क्योंकि those authorization numbers are for limited services, or you guys can say the limited time spans. Okay, means these could be for 1 month, 2 month, or 3 month maximum. Okay, so services not covered by pre-authorization. So the services which were done, you guys can say that rendered, these are not covered by pre-authorizations. Okay, so these could be the relationships to that kind of a denials, like authorization kind of a denials we can have. Next one is coding denials. Incorrect or outdated CPT, HCPCS, healthcare common procedure coding system codes, means the CPT codes which are used in the you guys can say the claim, these are obsolete, are outdated. Nowadays we are not going to use those kind of a codes, so that could be a denial reason. Invalid or missing ICD codes. Okay, so the a diagnosis code which is added into a claim, that is going to be the invalid, or you guys can say that missing. So that is the basic reason you guys can just have these kind of a denials as well. So you guys need to look for that kind of a diagnosis code. Okay, so you guys need to basically, the procedure code and the diagnosis code should be correlated with each other. Okay, next one is lack of supporting documentation for medical necessity. Yes, if you guys are just going to process that claim, or means you guys are going to done any kind of a surgery or any kind of a procedure, and your documentation is lacking that there was a not medical necessity to proceed with that kind of procedure, then insurance company is not going to pay for that claim. Okay, they are going to deny that claim because you guys are not going to have enough documentations to prove that that kind of a procedure was medically necessary. So for that kind of a reason, the medical billing companies or the AR kind of a person are going to provide different kind of a documentation, like the medical records, clinical records, or different kind of a medical things. So once they just send the appeal to insurance company, and insurance companies are going to process that claim in this way. So these kind of coding denials can arise in medical billing companies. Next one is going to be the medical necessity denials. Yes, service deemed medically unnecessary by the payer. So the payer is going, when the payer, like the insurance company, is going to review that claim, and they are thinking that the services that were provided were not medically necessary. So insurance companies may deny that claim. Next is non-covered services due to the policy restrictions. Yes, these services which are rendered to the patient, they were not allowed due to different kind of restrictions due to the policy of that kind of a patient's policy. So insurance cannot pay for that kind of claim, and they can just simply deny that claim. Next one is investigational or experimental treatments. So when the provider is going to do any kind of investigational or experimental treatments, then insurance companies are going to deny that claim. Okay. Next is payment related denials. Yes, denials due to the patient responsibility, deductibles, or co-payments, like insurance company did not pay any kind of a thing. They can say that the patient has not met the deductibles. Basically, the deductibles are the amounts which a patient needs to met before insurance kicks in. Okay, so if the patient does not meet their deductibles, then insurance company is not going to pay that kind of a claim. Basically, they are going to make the patient responsibility as a co-payment or co-insurance or deductibles. Next, we have claims submitted after the timely filing limit. Yes, different kind of insurance companies have different life. You guys can say that time spans through which our medical company needs to submit their claims. Like normally insurance companies have 3 months, 6 months, or 1 year. So whenever you guys are going to submit the claim, you guys need to submit the claim within the required time frame. So if your claim is submitted to an insurance company after that kind of a time span, then insurance company is not going to process that claim. Basically, they are going to deny that claim due to timely filing, that you guys haven't submitted your claim within the required time frame, so you guys cannot be paid. So whenever you are working with different kind of insurance companies or medical billing companies, you guys need to focus on this one. Next one is going to be the coordination of benefits issues between primary and secondary payers. Yes, you guys know that the primary and the secondary insurance companies have information for both of these. Like the secondary insurance have the information of the primary one, and the primary insurance company have the information of the secondary one. So when there is a like miscommunication, or you guys can say the patient has not updated his COB or coordination of benefits, then there could be a denial reason. Like you guys can just submit the claim to the secondary one, and secondary states that you guys need to first submit the claim to the primary insurance, then you guys need to submit the claim to secondary insurance. So this is the good way. So in this way, insurance companies can deny that claim too. The sixth one, denial kind of a reasons could be technical denials like claim format errors, electronic or paper submission issues. Some medical, you guys can say that the payers are going to accept the paper claims only. So whenever you are going to submit the electronic claim to them, they are not going to process that claim or adjudicate that claim, or they are not accepting that formats. So you guys need to submit the claims through paper. Okay, and some companies are going to accept the claims only electronically, so vice versa kind of situations can arise. Next is incorrect claim submission methods. The submission method that we used, or you guys can say that the medical billing companies use, that is not accepted by the payer. So due to this reason, the basically the claim can be rejected as well or denied as well. Missing or incorrect patient provided information. So whenever we are going to submit the claim to an insurance company, the patient's information and the provided information is already included in that kind of a claim. Okay, so when there is a mistake, or you guys can say that incorrect information regarding the patient, or you guys can say the provider, like the NPR, the tax ID, or the provider's address is incorrect, then insurance company is not going to process that claim. Basically they are going to deny that claim. So these were the basic denial reasons. Okay, so now we are moving to the steps in denials management. So how we are going to fix those kind of denials, or what are the best ways and means through which we guys can just fix those denials. So the first one is going to be the identifying and categorizing the denials. Okay, so you guys need to identify like what is the basic kind of a denial and how you guys can just fix this one. So let's say review denial reports. The first step in effective denial management is reviewing the explanation of benefits. As I've already mentioned, that insurance companies are going to send us the EOB's explanation of benefits when they are going to adjudicate or process that claim. Okay, our remittance, electronic remittance advice provided by the payer identify the specific reason for the each denial. Like there could be a duplicate denial reason, timely filing reason, or any other kind of a reason as well. Okay, so next one is categorize denials. So you guys need to categorize that kind of a denials. Denials should be grouped based on their causes. Categorize denials eligibility, coding errors, medical necessity allows you to identify trends and prioritize resolution efforts. Yes, you guys need to see that what kind of denials are going to arise whenever we are going to submit these kind of claims to an insurance company. Okay, so if they are going to deny the claims due to timely sensitivity, like medical necessity or timely filing, then you guys need to fix those kind of things on your end. Okay, so we need to identify and we need to categorize like what kind of a denials this insurance company is going to provide us. Okay, so are they going to deny our claims due to any technical issues, any coding issues? So you guys need to fix all those kind of stuff on your end. Okay, next one is denial analysis. Okay, so root cause analysis, understanding why claims are denied is crucial. It could be due to the incorrect coding, missing documentation, or issuing with patient's eligibility. Okay, so you guys need to find out the root cause. Okay, identifying patterns. Look for the patterns across multiple claims. For example, if a particular procedure code is frequently denied, it may indicate a coding issue or misunderstanding of payer policies. Yes, due to some kind of reasons, insurance companies or the payers are going to reveal that different kind of rules and regulations and payer policies. Okay, so some kind of like normally we have different kind of modifiers in medical coding as well. So some companies are going to have 59 modifier, XU modifier. So we need to understand the payer policies as well. We need to work on all that kind of a stuff. We need to find out that what kind of a denials we are going to have again and again, and we need to find the trends in those kind of a denials. So these are the basic reasons through which we can just find out different denial reasons and we can just fix them. Next one is perform data analytics. Using analytics software to track and analyze denial reasons helps pinpoint inefficiencies or recurring issues. Okay, so we can just perform a data analytics as well, so through which we can just verify that what kind of a trends these kind of a pairs are going to provide us different kind of a denials, and we can just verify on our end as well different kind of a things like coding issues. If we have a coding issues, then we need to fix that kind of a thing. Okay, so we are just going to discuss all those kind of steps in denial management. So we are just going to discuss only two, and the next one we will be just having in our next lecture. So this lecture is to be continued. So thank you so much for your attention. So if you guys have any kind of queries, you guys can just WhatsApp me as well, and you guys can send your queries via email as well, and I will get back to you as soon as possible. Okay, so inshallah we'll meet in the next lecture with different kind of a stuff. Like we will be just continuing this lecture, different kind of a steps, and we will be just seeing that how you guys can just fix those denials and what are the strategies to fix those denials as well. Okay, so that will be the lecture number 2. Okay, so inshallah we'll meet in the next lecture, that's lecture number 2. If you guys have any questions, concerns regarding this lecture or any kind of a stuff, then you guys can let me know. Take care of yourself and of your family, and do remember me in your kind prayers. Take care. Allah Hafiz.